Yes, sir.
Yeah, can you see my slide also? Is that okay?
Yes.
Okay. At the outset, I thank Dr. Ajit and, of course, ma'am, Dr. Sumesh and Duncan for chairing the session. And I am really honored to be here amidst you all, August gathering to share my views, thoughts, concepts, and passion. Erectile dysfunction is one of the most commonest complaints which diabetics have. And this is one of the most earliest complications of endothelial. It's a manifestation of endothelial dysfunction. With pranams to God and thanks to my teachers, Dr. O.P. Kapoor, Prakash Kothari, and Sashank Joshi, I beseech them to bless me always. I have some disclosures to give. This is our Prime Minister Modi ji. Look at his hands are down because he said, I'm offering you GST. I have no other go to go. Then he told me, Deepak, so look, my hands are up. He told me also to offer my GST. So I shall offer my GST to you all. And my GST is great sex therapy. What is erectile dysfunction?
Sir, you are not audible, sir.
Is it audible now?
I,
Erectile dysfunction has to be there at least 75 to 100% of the time during sexual activity. There should be a difficulty in obtaining and maintaining the erections for a complete sexual activity. And sometimes it may be due to reduced rigidity in the penis. And it has to be minimum 6 months with clinically significant distress, which is interpersonal distress amongst the partners. And it should not be attributed to any mental disorder, stressor, or any other medical problem. This is a beautiful diagram to understand what actually happens during erections. This is the endothelium, vascular endothelium of the penile vasculature, which produces endothelial nitric oxide synthetase, which converts the L-arginine into nitric oxide and potentiates the nitric oxide, which is the chemical signaling molecule, to enter into the corpora cavernosa smooth muscle cell. And this converts guanosine triphosphate into cyclic guanosine monophosphate with the help of an enzyme called guanylyl cyclase. This cyclic GMP, through various mechanisms, relaxes the smooth muscles of the penis and allows the blood to flow in. But sadly, this cyclic GMP hydrolyzes into 5-GMP with the help of an enzyme called phosphodiesterase 5. So if you look at the physiology, what actually happens to a man with erectile dysfunction is nothing but the endothelial cell not producing endothelial nitric oxide synthetase, and so nitric oxide is not produced. So there is basically the endothelium which gets dysfunctional. And this also helps us in knowing as to what actually you require for a good erection. You require a normal endothelium, you require nitric oxide, you require guanylyl cyclase activators and stimulators, you require cyclic GMP to be there in more bioavailable form, and you require something to block the PD5, which we have in the form of sildenafil, tadalafil, udanafil, vardenafil, and now new kid in the block, which is avanafil. So if you look at everything, what we today have is only this portion which could be inhibited, and we have drugs for this. We do not have anything above that. We have some nutraceuticals which produce nitric oxide with the help of L-arginine supplements. When you look at the endothelium, it has got myriad of potential consequences when it gets dysfunctional. It can cause inflammation, it can cause occlusion, it can cause peripheral vascular disease, hyperlipidemia, angiogenesis gets affected, thrombosis, everything. So today's concept is that penis has now become the barometer of endothelial health. The flaccid truth is, though it's an endothelial dysfunction, it also causes emotional dysfunctions. And the bitter truth is, all these are the manifestations of aging and age related complications, which include diabetes. So, when we think of aging, is aging a disease? Then, if so, life itself is a disease. No, friends. The main feature of aging process is a chronic progressive increase in the pro inflammatory status which we are all in. So this is controlled by a network of cellular and molecular defense mechanisms, and immunosenescence is the adaptive net result of our body's defense mechanism, which is a dynamic process. So we all are in a progressive pro-inflammatory status. Anything can happen, anything which can go wrong can produce any disease like diabetes, hypertension, etc. So when we call inflammaging, which causes all these particular disease through various activation of various pathways, and ultimately, we must remember, friends, that diabetes also is an inflammaging disease. Erectile dysfunction has got multiple etiologies. It could be psychogenic, vasculogenic, neurogenic, hormonogenic. It can be drug induced, and even now it has been proven that it is genetic, because they found a genetic variation in the SIM1 loci which is associated with erectile dysfunction after studying 36,650 patients. COVID-19 is again an endothelial disease, because in COVID-19, because of endothelial dysfunction, erectile dysfunction is seen, and they have found the coronaviruses in the penile tissues also. Though it is not there in the semen, it's not a sexually transmitted disease, but they have found coronaviruses in the muscles, in the other tissues of the corpora. And there is a bi-directional relationship. SARS-CoV-2 receptor angiotensin 1 converting enzyme type 2 is expressed in human pancreatic islet beta cells and is upregulated by the inflammatory stress. Hence, diabetes is not only a risk factor but also can get COVID. Diabetes, friends, is also the sexual health tsunami of our century. It's highly prevalent in India and China, and erectile dysfunction is the commonest complication of diabetes. So I call Chindia the erectile dysfunction capital of the world. Both type 1 and type 2 diabetics are associated with increased risk. In matched male aging studies, diabetic men showed threefold probability of having ED, including the hypertension also, which is nothing but again, due to shear stress, the endothelium gets affected. It produces erectile dysfunction. It is due to endothelial damage. Even in an obese patient, in obesogenic atmosphere, the visceral obesity stimulates the inflammatory responses, causes endothelial dysfunctions, microvascular diseases, and erectile dysfunction. And in obese patients, we have also seen there is testosterone deficiency. So men with metabolic syndrome have impaired endothelial dysfunctions, and prevalence of metabolic syndrome in men with organic disease almost double. So I call nothing ED is nothing but penile angina or penile attack. Why do we worry about erectile dysfunction? So what if man doesn't get erection? No, the issue is that erectile dysfunction is the earliest marker of myocardial ischemia. Montessori beautifully explained in the artery size hypothesis, penile artery being the smallest, coronary artery being slightly larger, and internal carotid being slightly more larger than the coronary. And if atherosclerosis has to set in, and if 50% of the arteries get blocked, it produces symptoms correlated to that particular artery. So 50% of penile artery, if it gets blocked due to atherosclerosis, produces erectile dysfunction. But atherosclerosis is generalized. The same amount of atherosclerosis does not occlude 50% of the coronary artery to give symptoms of the coronary artery occlusion or symptoms of the internal carotid artery occlusions. But we know atherosclerosis is progressive. Sooner or later, this 50% of the penile artery can get 100% blocked, and even this can become 50%, so we can get a symptom. So what I want to make you understand, that erectile dysfunction precedes the coronary artery disease in most of these Indians in our country, at least by 3 to 5 years. So we have a window period of curability where we can alter the milieu of our patients who have got diabetes or hypertension or atherosclerosis to any sort. So I call penile attack almost equate heart attack. Real world observational studies showed that erectile dysfunction, diabetes, cardiovascular disease, and depression are all interrelated. So practitioners should always be aware. We must ask our patients who have a family history of metabolic syndrome as early as 30 years. It is no point in asking when he gets angina or he undergoes CABG or angioplasty. You have missed the boat. So you ask them before he develops clinically cardiac events that do you have any problems in making love. Friends, you will make a lot of difference in their life. How do we manage erectile dysfunction? We must call the couple together. There may be a problem with the man or a woman, but the solution always lies with the couple. We have two beautiful questionnaires, IIEF and SHIM. And first, rule out psychogenic causes. If the patient is getting morning erection in last 8 to 10 days, this patient does not have any organic erectile dysfunction. He has psychogenic erectile dysfunction. He needs to be counseled. He doesn't need PD5 inhibitors. We have a lot of strategies to manage. Look for ask him to avoid smoking, improve his diet, exercise, blood pressure, lipids, diabetes. Most important thing in this particular slide I want to make it clear is, please examine your patient's retina. Feet and oral hygiene needs to be examined every time the patient comes to your clinic. Put them on a heart friendly drugs like aspirin, ACE inhibitors and statins. Work them up for heart and give them certain drugs if they need. We also do cremasteric reflex and bulbocavernous reflex to rule out any neurological disorder. Other hormone studies which we do are as follows. We also do digital rectal examination and Regiscan. Regiscan is a new instrument which is to check, to rule out psychogenic with organic ED. What we do is we tie two electrodes at the base and the tip of the penis and connect to this gadget and make the patient sleep. In deep REM sleep, every patient gets 3 to 4 erections which last for 15 to 20 minutes. And this could be easily plotted. This is a normal plotting of a patient who has got psychogenic ED, and this is a plot with patients who have got severe organic. You will not find erection. So this is how we can rule out and document psychogenic from organic ED. But I don't send my patients for these particular tests because it's cumbersome, expensive. I give them a roller of stamps which I get free of cost from the post office. I tell them to tie it snugly on the shaft of the penis and sleep. If this breaks, he's got psychogenic ED. He does not need any medications. He just needs counseling. Salivary tumor necrosis factor alpha in diabetics is an indicator of severity of erectile dysfunction. It's very simple to take a swab of the gums and just check it up. The relationship between platelet and lymphocyte ratio, simple CBC will tell you. Look at his total platelet count and lymphocyte count and do a ratio. If the ratio is about 105, he's got mild. If he's 116, he's got moderate. And if he's got more than 136 is the ratio, he's got severe erectile dysfunction. So by just looking at the CBC, you can diagnose the severity of erectile dysfunction if you are embarrassed to ask your patients about this sexual problem. And once you know that he's, by doing a mental calculation, that he's got mild, moderate or severe, and then if you ask him, you confront with him, he will call you to be a Sai Baba. How did you know, doctor? I did not tell you anything. Yes, I have this problem. So how do we treat erectile dysfunction? The first line of treatment is oral drugs. Second line is injections of papaverine and largactil in the intracavernous tissue, vacuum therapy, intraurethral prostaglandins. And if all these fail, we send our patients to urologists who do implants or anastomotic surgery. But what is most striking here is, in this particular chart, that counseling and lifestyle measures are the mainstay of treatment of every patient of erectile dysfunctions. The revision of 2018 process of care model also shows that lifestyle changes should be the first line of medical therapy along with counseling. We have 4 different types of PD5 inhibitors. The faster onset of action is vardenafil, which also has less side effects, but they all have side effects like headache, nasal congestion, visual disturbances, and we should be very cautious in giving to patients who are on nitrates or who have potentially hypotension or have some anatomical penile defect or anemias or leukemias, etc. We give our patients a daily low dose of PD5 inhibitors because this has known to produce improvement in endothelium by causing vasodilatation, increasing the nitric oxide, endothelin 1, reducing the other harmful things. And also it reduces the thromboresistance. It is an anti-inflammatory. It increases the smooth muscle inhibition, etc. Beautiful study says that 12 weeks of treatment with tadalafil, low dose, 10 mg, even if the HbA1c is more than 9, or if he has hypertension, or if he has BPH, or even dyslipidemia, showed improvement in sexual dysfunctions. My friend Dr. Jyoti Dev from Trivandrum. He put his patients on insulin pump and it showed improved sexual functions in almost 83% of the patients. So this is a very good thing which we can try it out. Endothelium improvement is also seen with metformin, and this has been now given as an adjunct to patients with erectile dysfunctions. SGLT2 inhibitors, because of its class effects, weight loss, reduction in HbA1c, reducing dyslipidemia, also hypertension is reduced. And if you give metformin and SGLT2 combination to your patients, these patients get physiological erections because of the class effects of the drugs, and these patients then don't need PDE5 inhibitors. So that's the buried pendant syndrome is very common in diabetics who have got little obesity. Put them on 1 gram of metformin, sesame seed oil to be rubbed on the shaft twice a day, and L-arginine gel to be applied twice a day. In less than 6 weeks, you can find the penis being visible, and then put them on PDE5 inhibitors. They will show good improvement. Novel treatments include low intensity shockwave therapy, PRPs, but all these have been proven to be good in only mild to moderate erectile dysfunction, and all those patients who do not want to take medications, this is very effective. When we look at treating ED, we have got so many things to give in our armamentarium, but what we have found that none of these therapies, however, reverse the pathophysiology of erection, which is nothing but endothelium. So what we need to focus on is to improving the endothelial functions, which now there are newer targets, platelets, microparticles, myeloperoxidase, sonic hedgehog, galanin, stromal vascular fraction, VEGF, soluble guanylate cyclase activators, Rho kinase inhibitors. Most important and most effective promising therapies have been stem cell and gene therapy, which have been studied in diabetics also. A beautiful study which is now shown that diabetic impotence with umbilical blood stem cell intracavernosal transplant of 15 million cells in 7 diabetic patients showed 99% of these patients, 6 out of 7, regained morning erections within 3 months. So this was the improvement, and also there was improvement in insulin resistance. So not only their diabetes gets controlled, also they have normal physiological erections. Even L-arginine, if combined with saponized fenugreek, have shown to modulate the glucose and lipid metabolism, especially in diabetics. So this L-arginine is now available as a nutraceutical, very safe. It is a metabolically potent amino acid, it's not at all harmful, and fenugreek is nothing but methi, which we all eat in day-to-day life, but in a saponized form. They have shown to improve the nitric oxide production, and also the free testosterone production is increased, which improves the desire as well as the arousals. What is new in medical treatment for diabetics? We have Avanafil, which has got the fastest onset of action. It's the newest PDE5 inhibitor available in India. Action is within 15 minutes, less side effects, and it has got a half-life of 5 hours. So you can easily give to your patients who are also on nitrates. Only caution, ask them not to take nitrates on the day when they are taking Avanafil. And Avanafil will get washed from your body in 5 hours. So next day again, he can start his nitrates. Let me give you my last part of my slide, ethical perspective. See, PDE5 inhibitors have now been proven to be therapeutic, because what PDE5 inhibitors do, they increase the PGC1 alpha levels, which increases the antioxidant enzymes, reduces the reactive oxygen species in the mitochondrium, improves the ETC complex, and improves the contractile function, and reduces the cell death by increasing more ATP. So in diabetics, PDE5 inhibitors are very, very helpful. We have understood the effects of SGLT2 inhibitors and metformin. We also are aware of the recent direct trial, which has shown remission of type 2 diabetes. So the type 2 diabetes is cured as ED is the complication of diabetes. We have seen physiological erection in these patients. My friend Dr. Paresh Tundona gave testosterone to hypogonad patients with diabetes, and he found in 1 year of treatment, these patients showed fantastic improvement in their sexual functions. Dean Ornish long time back proved that with intensive lifestyle changes, even the worst coronary artery disease can be reversed. He has proved it beyond doubts. And what about genes? 20% of what happens to us is because of genes, and 80% is dictated by our lifestyles. So Prabhakaran beautifully said, today we have got control in everything of our life except one thing, because of which the cardiovascular diseases are on the rise, and that is the healthy diet score, which is missing in us. So what we need to understand is, it is the diet which is very important, the nutrition which is very important for us. We need to take care of that. So even Cleveland clearly proved that nutritional intervention in their research showed it will not only halt but even reverse the coronary artery disease. Look at his huge plaque, improved just without stenting, only with nutrition. So we need to focus more today on the nutrition, on your lifestyle measures, which is very important and which is possible, which is in our hands. We don't need to take anything. Thomas Edison, hundreds years back, he said, the doctor of the future will no longer treat human frame with drugs, but rather will cure and prevent disease with nutrition. When we look at the endothelium dysfunction, do we have something to reverse it? Yes, we have statins, we have ACE inhibitors, antioxidants, L-arginine. 4 weeks of L-arginine improved the endothelial functions to a greater extent, which was studied with. My teacher, Dr. R.D. Lele, has showed several strategies to reverse endothelial dysfunctions, which are now available to all us. So the future is very bright. If we try to tackle endothelium as early as possible in patients, we can see a success. We can see a very important public health benefit in the next millennium. So friends, what we need to understand, we need to hug each other, we need to be touching each other. We lack in vitamin T, we lack in vitamin R. There is no romance after 40 years of your life. Why? There is no GST. Friends, you can be romantic till the end of your life. Nothing wrong with that. And it's a shame for a man to grow old without seeing the beauty and strength of his body is made up of. So we need to change. My take home message is, the secret of sexual fitness is you love your body. Tell your patients blanket that he should not take excess of salt, excess of oil, and excess of sugar right from the age of 30. Give a U-turn to metabolic imbalance. Have a regular rhythm of sex life. Vitamin R and vitamin touch are extremely important at late stage of our life. So the onus of sexual health of our patient lies with we physicians. We need to be proactive and ask our patients, do you have problems in making love? Teach them what is realistic. Make them expect what is realistic. Don't give them wrong hopes or anything. Let them understand. Take a detailed history of your patients, because lifestyle recommendations will not only reduce the pro-inflammatory milieu, will reduce the insulin resistance, will reduce the oxidative stress, and will also improve the endothelial dysfunction. This will give improved well-being and reduced burden of sexual Prize winner Dr. Linus Pauling clearly said, nearly while taking his Nobel Prize, he said nearly all diseases can be traced to a nutritional deficiency. So friends, food isn't like medicine. It is the medicine which we need to take every day. Lifestyle, you may be Hindu, Muslim, Sikh, whatever. Make lifestyle as your first religion and medicines. We have all PDE5 inhibitors, but none of these increase the desire. We have 40% of patients who do not respond to these. So we have testosterone, but we need to give it with caution. We can't give it to younger patients because of azoospermia. We can't give it to the elder patients who can develop heart failure or prostate tissue. So who's the Raja of all? We have L-arginine, fenugreek, lifestyle measures to be taken as the best of all treatments which we have today in our armamentarium. So for male sexual response, we have testosterone, L-arginine, fenugreek to improve desire, L-arginine, PD5 to give them good arousals or erections. So what do we want? Erectile dysfunction due to any cause is possible that it can be halted and reversed. We need to understand to love each other unconditionally, your partners for life. Unless we love and are loved, each one of us is alone, each one of us is deeply lonely. We need to be together, we need to be monogamous, we need to work out on our bodies, we need to work out on lifestyle measures for ourselves. And feminism needs to be adored, admired, trusted, and respected. Men have issues, women do not have. They deprive their partners of not having sex or their rights, which is wrong. They should take treatment which is available today to all of us. And all men need to be passionate, fearless, and focused, even in the bedroom, like our Prime Minister. Erectile dysfunction in diabetics, friends, is not an option, not for anyone, but it is how gracefully we handle the process and how lucky we are as the process handles us. So today we have so many things to give to our patients with erectile dysfunction that this is a symptom which can be managed very easily if if you have empathy for your patients, if you are honest, and if you are sincere enough to tackle all the issues holistically. So it is really nice to know that if you diagnose erectile dysfunction, it is a blessing in disguise, because most of the etiologies of erectile dysfunctions can be managed. So today, erectile dysfunction is a correctile dysfunctions. If you have patients of erectile dysfunction, don't send them to quacks. वो सिर्फ पुंगी बजाएगा, he will do nothing. Send them to good sexologists and he will see that he gets a good erections. So friends, this is my book, Sex Really Has No Expiry Date, available on Amazon. My last slide. ED is the most common male sexual dysfunction. It's a tip of an iceberg. Is the earliest marker of coronary artery disease. It's an endothelial dysfunction. I call it a diabetes type 5. And PD5 inhibitors, short course of testosterone, are ideal. L-arginine supplement with fenugreek is a boon. A heart that loves is always young. Age, weight, height are just numbers. Lifestyle measures can reverse the metabolic syndrome. So hence, erectile dysfunction, friends, is a correctile dysfunction. And if so, sex really has no expiry date. Thank you all for your love. I'll be happy to answer any questions you all have.
Thank you, Dr. Deepak Jumani, sir, for the excellent presentation. Now it's open.